Hey, this is Dr. Renicki with CellGen Regenerative Medicine in Savannah, Georgia. So very often when a person has scheduled an appointment for a regenerative medicine evaluation, they want to know what kind of things, if anything, do they need to do different before they arrive for that appointment. So one of the ways that regenerative medicine works is that the regenerative medicine treatments, whether it be stem cell or platelet-rich plasma, helping to use your body's own stem cells to create some healing and repair, they work very much based on finding inflammation. Remember that the way stem cells always are supposed to work inside of our body is that when there's injury or damage, which will create inflammation, then stem cells are attracted and drawn to that inflammation. So if you're doing anything to get rid of inflammation, then you're going to be working against the way that regenerative medicine works. So before you present for a regenerative medicine evaluation and examination, you would want to avoid anything that is anti-inflammatory. So this is something obviously where you would want to check with your doctor about what you can and cannot safely change with that, but anything that is an anti-inflammatory is going to make it to where we won't be able to find out quite as well what's really causing the problem. And then if you elect to receive any treatment on that visit, then you're not going to get quite the same benefit from it. I'm not saying that you can't do it. It's just going to change the effectiveness. And obviously, you want to get the maximum amount of effectiveness out of it. So I would avoid ice, I would avoid non-steroidal anti-inflammatory drugs, and things like that. Certainly cortisone, those kinds of things are all going to make it to where you're going to get less effectiveness from the examination and from any treatment you choose or elect to receive. You can still use heat. Heat doesn't get rid of inflammation, it actually promotes inflammation a little bit. So the heat may help to temporarily relieve some pain, but it may in the long term increase the pain. But it can actually make it to where the regenerative medicine therapy could work even a little bit better perhaps. So those are the things that you would want to avoid prior to a regenerative medicine examination. There are going to be other factors as far as clotting factors and blood thinners and things like that that could play a role there as well. So again, you'll want to talk with your doctor and you'll want to talk with the medical team there at your regenerative medicine provider about what are some of the ins and outs of that, what lab work and blood tests may be necessary to know whether you are a candidate for that or not if you're taking any kind of blood thinners and those types of issues. So I thank you for your time and attention. By all means, if you think that this is something that could help you, please reach out to us. We'd love to see if you're a good candidate for regenerative medicine or not, and we can certainly give you some very specific information about any medications that could change the effectiveness of your regenerative medicine treatment, or whether you're going to be a candidate for receiving it at that particular moment or not. So thanks for your time and attention. We look forward to seeing if we can help. CellGen Regenerative Medicine in Savannah, Georgia.